Hi, this is Dr. Karen Nagelkirk. In my 30 years of providing audiology and hearing aid services in the West Michigan area, I find there are a lot of questions clients have that they have trouble finding the answers to. This video series, Sound Hearing Advice, was developed to help get the answers you deserve. Today's question is, I think I might have some hearing loss. What should I do first? Or, someone else knows I have a hearing loss. What should I do first? There are several things that can happen to someone with hearing loss. Many times it is more noticeable to those around you before you are actually aware. For example, I just had a client who swore up and down that he could hear just fine if his wife would stop mumbling. Turns out he had a hearing loss. So what is the first step? Short answer, a hearing test from a doctor of audiology. During the exam, we will test your hearing across different frequencies, the speech frequencies, including how well you hear in noisy environments, and then let you know what the appropriate next step is. We don't just test your hearing for hearing aids. We test your hearing to discover if there's a problem with the whole hearing system and where that problem is, so we know what to do and how to refer. Many times it can be wax in the ear, in the outer ear canal. You could have a temporary hearing loss, like an ear infection after pneumonia, or in some cases a permanent type of hearing loss, which will require hearing instruments. This is the most common occurrence. But you don't know unless you schedule time for a hearing test. Schedule yours today. That's it for today. If you want answers to your questions, please don't hesitate to call me personally. You can get instant access to other videos like this on our YouTube channel or by visiting our website at www.vandoornehearing.com. Until next time.